So Richard came to me with a rather common problem that a lot of older men face, and that's just simple enlargement of the prostate. And so there's a certain subtype of men whose prostates grow much more rapidly than others. And that can lead to things such as bladder infections, stones in the bladder, blood in the urine, and then the worst case scenario, which is inability to urinate and possibly damage to the kidneys. Richard came in, he couldn't urinate.
Being 63 years old, I had not had anything to do with a prostate exam since the age of 43, so it was a 20-year span. And so definitely I was avoiding the exams that I should have been having.
And in his case, it was a difficult situation because his prostate was about 8 times the size of normal.
And he frankly told me that yours is the largest I have ever seen.
And when prostates are very, very large, the traditional treatment, which is to typically carve out the prostate from the inside, was not possible because his prostate gland was just too big. So Richard's specific treatment options would have been a catheter for life that he would change every month, to self-catheterize himself 3 times a day for the rest of his life, to have an open simple prostatectomy, which involves a rather large incision from his belly button all the way down to his pubic bone, or to have 5 small incisions and then use a robot to perform the same procedure as the open procedure, but with a lot less morbidity, shorter hospital stay, and less blood loss.
He said, I'm going to try do it robotically, but if I have any problems, we're going to have to do open. And so then I went ahead and said, Dr. White, I have all the faith and confidence in you. You do whatever it is that you have to do.
So Richard was actually the first person in South Texas to have a robotic simple prostatectomy. Richard's recovery has been fantastic. He is urinating without difficulty. He's urinating better than he has in many, many years, and he's extremely happy, and he healed quite fast. He was only in the hospital 2 days.
The recovery has been tremendous. I couldn't imagine going another week, another day in the situation that I was in. The quality of life is 100% better.